Good morning, I'm Diane Macedo. Thanks for streaming with us. In today's update, an investigation is underway in Mexico City after an overpass collapsed while a subway train was crossing over it. At least 23 people are dead and dozens more injured after the train crashed on the traffic below. Mexico City's mayor says a support beam underneath the overpass gave way, but investigators are still determining the official cause. Severe weather has been wreaking havoc across the U.S. More than 220 damaging storms were reported in the last 24 hours from Texas to Maryland, including more than a dozen reported tornadoes. Now a storm that brought 80 miles per hour winds through Texas is moving east, putting more states on alert for severe thunderstorms, and a strong possibility of tornadoes in the south, with Louisiana, Mississippi, and Alabama under the biggest threat. Meanwhile, New York, New Jersey, and Connecticut have announced plans to lift most pandemic capacity restrictions for places like bars, restaurants, and gyms. The news comes as weekly COVID cases in the U.S. fall below 50,000. The mayor of Atlantic City, New Jersey, says he's optimistic about reopening, but says they will scale back if needed.
We'll pay attention to the stats, and we'll make the responsible decision if we need to pull anything back. But right now, with the amount of people vaccinated and constant testing going on, I'm looking forward to a robust summer, and I can't wait. So come on down to Atlantic City, everyone.
New Jersey will still require 6 feet of social distancing. And according to the CDC, roughly 56% of the U.S. adult population has now received at least one dose of the vaccine. So is a return to normalcy on the horizon? Dr. Alok Patel from Stanford Children's Health is here with more. Dr. Patel, thanks so much for being here. The weekly case average nationwide fell below 50,000 for the first time since October. So what do you make of that? Is the end of this pandemic in sight?
Well, Diane, the end of it is a relative term, and I think if we're thinking locally, as in the United States, this is great news. And it is time to really think about reopening and rewarding everyone for what we've done for the past year and a half. But we still have a lot of work to do, not only when it comes to vaccinations, but making sure that we can mitigate whatever may happen as we reopen. And the one thing that everyone needs to really understand is that if the pandemic is controlled in the United States, that doesn't necessarily mean it is globally, because we're seeing outbreaks in Brazil, Turkey, and India, and honestly, infections are just a flight away, so we have to stay on top of it.
Now, Pfizer's vaccine is on track for emergency use authorization for children ages 12 to 15, really any day now. So what kind of an impact do you think that would have on this, attempt to return to normalcy?
Well, a lot of people are excited about this. And then on the other hand, there's another group of people who rightfully are saying, well, 12 to 15 years old, they're low risk. What's the big deal? But what people need to really understand is that children make up a large proportion of the population in the United States, but also can make a potential large vector for infections. So we're not only looking at protecting those children aged 12 to 15 and getting them ready to go back to school, back into their normal lives, we're also essentially protecting everyone around those kids. That's other children, grandparents, parents, or anyone else who may not be able to get their vaccine. So this is an important step forward in getting us to as close to herd immunity as possible.
And what's the timeline for younger kids to get vaccinated?
Well, when we go below the age of 12, we have trials coming out from Moderna and Pfizer, and we're looking to see that we might see some preliminary data by the end of this year, but I wouldn't bank on anything being authorized until a little bit later in 2021, if not early 22. So right now, we really have to focus on those younger adolescents right in that 12 to 15 age range.
Now, that said, the American Academy of Pediatrics is reporting that children now account for 22% of new U.S. COVID cases. Why is that?
Well, and that's exactly what I was kind of hinting at earlier, is that even though children themselves represent a lower risk group in terms of hospitalizations or severe illness, even though they can get sick, children are right now, they're unprotected, they're unvaccinated. So as we reopen and cases are still out there, children can absolutely make up a larger proportion of who's actually getting infected, but also who can continue to spread the virus. And we saw a case report of this happening in Michigan, and that's exactly what we're trying to prevent right now.
Now, the U.S. travel ban from India takes effect today as the official COVID case count there tops 20 million. So what do Indian and world leaders need to do right now to help get that surge there under control?
Well, it's a completely heartbreaking situation, Diane, as we look to see what's happening in India, total collapse of the healthcare situation. I think the biggest thing people need to do globally is not just look at the headlines or the news stories and say, oh my gosh, that's sad, and then move on. India represents a case of what can absolutely happen if there is under protection from vaccines, if there's reopening too soon, and if countries aren't prepared for it. So as far as looking at India and saying, what can we do on a global scale to help by donating PPE, oxygen tanks, what the average consumer, the average citizen can do, we also need to use India as an example of what we need to be prepared for, because that can't happen anywhere, especially when we're not vaccinating enough, when there's still variants out there, and when we're reopening too soon.
All right, Dr. Alok Patel of Stanford Children's Health. It's always great to have you, Doctor. Thank you.
Thank you.
And one of the world's most famous restaurants is making a revolutionary transformation. New York City's acclaimed 11 Madison Park is set to reopen with a new plant-based menu. The chef and owner says the restaurant's creativity has always been tied to a specific moment in time, and that it was clear they needed to make a change. The move could be a game changer for the whole industry. Here's Will Reeve on that.
Steak, lobster, fish, and caviar, staples of the dining elite. Until now. In a head-spinning, potentially industry-redefining announcement, New York City's 11 Madison Park, with a perfect 4-star rating from the New York Times, an elusive 3-star Michelin rating, and ranked #1 on the world's 50 best restaurants list in 2017, revealing that when it reopens in June after a prolonged pandemic-induced shutdown, its menu will be 100% vegan.
The way we have sourced our food, the way we're consuming our food, the way we eat meat, it is not sustainable.
Yeah.
And that is not an opinion.
They're still charging $335 for each person to dine at this restaurant. So it's how comfortable are we paying this much for vegetables? And the big question is, are people willing to do it? And I think that's what everyone will have their eye on.
Daniel Hume, 11 Madison Park's head chef and owner, announcing the menu overhaul on the popular NPR podcast, How I Built This.
So like no meat, no animal products.
Yeah, we decided we have to put our creativity towards a plant-based diet.
11 Madison Park's announcement coming on the heels of recipe app and website Epicurious phasing out new beef recipes. Trend watchers point out that more Americans are going vegetarian, and stars like Beyonce, Jay-Z, Meghan Markle, and Kim Kardashian all adhere to the diet. But will plant-based dining become the future of restaurants?
It's definitely feasible that we'll see more restaurant menus that are meat-free. So if a place like 11 Madison Park does succeed, it can only lead to more openings of this sort.
Diane, 11 Madison Park says that it has evolved its business model as well. When it reopens on June 10th, every dinner purchased will provide 5 meals to food-insecure New Yorkers. The menu here has not yet fully been revealed, but it won't be entirely vegan. You can still get milk with your post-dinner coffee or tea. Diane?
All right, looking forward to checking it out. We'll Reeve at 11 Madison Park here in New York. Thank you. And when we come back, we're going to take you to one of the toughest places in the world to live as a kid, a Syrian camp teeming with extremists. See the conditions for yourself and hear the story of one child who made it out after the break. Welcome back. The 10-year-long war in Syria has shattered life for an entire generation. More than 22,000 children have been placed in refugee camps and detention centers as a result of the war with ISIS. ABC News' James Longman traveled to a refugee camp near the Syria-Iraq border for an inside look.
In every war, children suffer. But after 10 years of conflict in Syria, an entire generation has been lost, and the situation is now getting even worse. This is the Al-Hol refugee camp in the northeast of the country. It was set up for the families of ISIS members as their so-called caliphate fell. But with international attention elsewhere, it's now become an almost lawless, festering wound on the landscape. We were last there a year ago.
It's very clear that still they have these radical ideas. They were really influenced and affected by the years they have spent under ISIS control in different locations.
There are tales of beheadings, honor killings, and even slavery, a mini ISIS regime. As extremism poisons the air, the innocent suffocate, and the cost is mounting.
People have left little markers, little identifiers. There's a tile where they've tried to etch someone's name on. Mostly it's little blankets that perhaps were used at some point to swaddle the children who are buried here. This is essentially a gravesite for children. And yes, it's the legacy of ISIS, but it's also the consequence of leaving thousands of people stranded in the desert.
More than 22,000 children of at least 60 nationalities are still languishing here and at other camps and detention centres. UNICEF is among the charities working hard to find a future for them. Last year at their orphanage, we met 13-year-old Zakaria. He'd lost both legs in an explosion.
Should I smile? Zakaria. Oh, okay. It's me, James. Zakaria is from Deir ez-Zor, which is the last place ISIS held on to at the end of the fight last year. He's obviously had a rough time. Kam umrak? 13-year-olds.
For 2 years, he was stuck at Hull, paying for the crimes of others.
And Zakaria came to you severely injured, I'm assuming?
Yes.
Yeah.
Without parents. I mean, each child of them, they have their own story. And we are following on that individual cases. Each one of them has passed through a very difficult situation, have his own suffering. But I think they are trying to cope with the situation. They are doing well, but still, I mean, it's not easy.
But 1 year on, we got news that Zakaria had been given new legs and had left Al Hol camp. Some hope at last. We sent our producer to find him. A complicated and dangerous search that took him hundreds of miles south. We found him, but the discovery was devastating.
Assalamu alaikum. Kifak? Zakaria? Kifak? Shو akhbarak?
An uncle had claimed Zakaria, and so he'd been reunited with family. But he sits alone most of the day in a room he shares with 7 other people. And the legs, they don't work.
I can't use them because the ground here is not flat, and the knees do not twist. So these prosthetics do not help me to walk. I don't know. I thought these prosthetics would be like the real ones, where I could walk, play, and work with them. But they've never helped. When I was told about them, I was excited. I thought they'd have knees that would bend so I could walk with them. I don't know what to do, and we don't have the money to buy better ones. These legs won't help me.
UNICEF says Zakaria was fitted with the new legs by a local hospital, but in a country at war with tens of thousands of children to provide for, following up and keeping track of individual cases is very hard.
The governorates in the north and east do need a lot more support, and that is, really also why we continue to advocate for more resources to be able to expand those services.
Zakaria needs new legs because the life waiting for him is unimaginably hard. Other families here have also left Hull camp and they're scraping an existence. Prices have rocketed. UNICEF says the cost of the average food basket has gone up 230% in the last year. Water and bread is almost beyond their means. The defeat of ISIS didn't mean the end of misery in Syria. In fact, the devastation the war brought will make life almost unlivable for years to come. Zakaria and thousands like him need all the help they can get if they're going to stand any chance at all.
He loses his life. Living without legs has no value. A person who doesn't have legs can't walk, play with friends, go out, or work. Just sitting, as if he doesn't exist in life. He sees people doing everything, and he's just in his place.
James Longman for ABC News.
Heartbreaking. Our thanks to James Longman for that report. And that does it for this ABC News Live update. I'm Diane Macedo. Thanks for joining us. And remember, ABC News Live is here for you all day with the latest news, context, and analysis. I'll see you back here at 3 p.m. Eastern with Terry Moran for the breakdown.
Let's fly away. Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.